Hello, good afternoon. Thank you all so much for joining us for Kidney Connections this afternoon. I'm Rachel DePaul. I'm the Vice President of Programs at the National Kidney Foundation of Illinois, and we're so honored to have you at this webinar. The mission of the National Kidney Foundation of Illinois is to improve the health and well-being of people at risk for or affected by kidney disease through prevention, education, and empowerment. And I'd also like to take a moment to thank our sponsors. Fresenius Kidney Care, as well as Northwestern Medicine. And I'd like to just have a really quick reminder to please remember to check out NKFI on social media, like, follow, and then we also have our Journey Continues podcast, which is at a very exciting time as we do have some video-based podcasts coming out, and you'll get to meet our one of our stellar hosts this afternoon on today's webinar. As we go through today, if you'd like to ask any questions during the panel, either make sure to click the raise hand option on Zoom so we can unmute you so you can ask your question, or you're also welcome to type your question into the chat at the bottom of the screen. And now I'm really excited to introduce our facilitator. Anita Phillip is a nurse practitioner with a deep passion for caring for patients with kidney disease. She is dedicated to educating both her patients and the broader community on kidney health and strategies to prevent disease progression. And she is pleased to be part of today's session. So Anita, I'm going to turn it right over to you.
Thank you, Rachel. It's great to be here with you all today. To begin, I'm very pleased to introduce Amy Jachna, who will walk us through the donor perspective and what potential donors should know. And Amy is a nurse, is a living kidney donor nurse coordinator from University of Chicago. And I will give the podium to Amy now.
Thanks so much, Anita. I appreciate that. I'm just going to bring up my presentation here really quickly. Okay, so thank you so much for being here. I'm just going to walk us through the donor perspective of, what potential donors should know. So here we go. So first of all, and you may already know this, but the kidney transplant's purpose is to provide a functional kidney to somebody with little to no kidney function. And of course, there's many options as far as to how to get a kidney transplant, but why living donation? Why, do we proceed with that and have living donors? And there's two really big reasons why. The number one reason, is because there's a higher success rate. Your length of time that a kidney would last for a deceased donor transplant is more like 8 to 15 years, whereas if it's a living donor transplant, it could be 20 to even up to 40 years. And also I will say too, there's a lot of planning that goes into transplants generally, but when you have a living donor transplant, you can do all of this planning very, very slowly and methodically. So there's just a lot more opportunity for that rather than, hey, we have an organ and it's the middle of the night and all these other things. So it just gives us more opportunity to be even more detail oriented than we already are. Another good reason to proceed with living donation is because there's a decreased wait time for the recipient. So as we all likely know, there's a lot of people that are waiting for kidney transplants, 90,000 individuals, according to the National Kidney Registry. And that's, it's a lot of people waiting. So if you're able to kind of have a living donor who's ready to go and the recipient's ready to go, it could be a matter of, at least right now, University of Chicago, maybe like a month to a month and a half before you can schedule an operating room as long as everybody's, safe to proceed. So that can be a much faster situation rather than waiting for years on the list. So how do we get started? There's a few ways that living donors can donate. They can donate directly, they can donate indirectly or anonymously. And I'm going to explain kind of what that means. So when we think of living donation, I think the first thing we think of is direct donation or donating your organ kidney directly to the recipient. And there's some testing that's required to see, can we proceed that way? Two tests that we do, right, to kind of start, we call it a cross match, but realistically, it's more like testing your blood type and doing a serum cross match. So the first thing we do is test your blood type. And you can see here, kind of who would be compatible with who, donors with blood type A, et cetera, can donate to these blood types. And you may notice on here, we don't see like plus or minus or what's called the RH factor. That actually, the RH factor is not a factor when it comes to direct donation for kidney donation. So, that's one of those kind of myths that's floating out there. And I've heard that from donors previously, hey, well, I'm O negative and he's O positive, so I can't donate to him. And, just to kind of give you that piece of information that would not be a factor in this case. But yeah, so blood type, it just depends on what the blood types are and are they compatible and, all of that. So the second part, let's say your blood types are compatible. The second thing we would do is called a serum cross match. And there's two things that are kind of going on in that serum cross match. The first thing is tissue typing. So we're looking, at the donor and seeing what is their tissue typing. And we're comparing that to that of the recipient. And it's kind of telling us what, and not to get too technical because we could talk about this for hours, but, what are the number of mismatches? And also they're looking at antibody testing and they're saying, are there any what's called donor specific antibodies that are happening during this cross match that would make it, so that we couldn't proceed. So the outcome of that is either the cross match is positive or negative. And like I said, I could talk for hours about all of this and how technical it can get, but basically the outcome is, are you compatible or are you not? And so in the event that, let's say, it's negative, there's no reaction, that basically means it kind of tells us what would happen if you were to take the donor's kidney and put it inside of the recipient. It gives us that outcome. Let's say the result is positive. There's still other ways that you can proceed. There's indirect donation, and specifically at University of Chicago, the organization that we work with is the National Kidney Registry. And there's a lot of, again, very technical things that go into this, but essentially you're entered as a pair into a database once everybody's, of course, safe and good to move forward. And then you're kind of put out there into this computer system, and they find matches for the donor and for the recipient and all of that. So there's a lot of good information on their website. I'd highly recommend, even just general like living donor information if you want to check that out. But just to kind of give you an idea of, there is other ways to proceed if you're not a direct match. Another way that sometimes people come forward is anonymous donation. There are people out there in this world that are kind of, they want to be a kidney donor and they want to give a kidney to someone, and, they are kind of like, hey, I'm a non-directed donor is what we call it. So just to kind of like let you know that does potentially exist out there as well. We certainly have people, University of Chicago who step forward and do this, which is pretty incredible. So regardless of how you kind of donate, the process is still the same. We need to make sure that you're safe to be able to, donate. And it's very similar, honestly, to like a recipient evaluation. A donor evaluation is the same. We do a lot of testing, which I'll get to in a second. But it's really kind of looking at the medical perspective, the surgical perspective, and also psychological perspective, making sure, you're mentally fit from that perspective to be able to endure donation. Also, during this process, the donor is gathering a lot of information that they may not have had before. So they need to be able to consent to be able to continue as well. So there's some things that could possibly rule you out from being a kidney donor. And, sometimes some of the myths people talk about are like, oh, you have to be related and things like that. It's totally possible to be a match for somebody if you're not related to them. So, but being younger than 18, that would prevent you from donating. And of course, you must be generally healthy overall. And I will say, in my experience as a living donor coordinator, some of these health conditions, it can really vary from center to center as to who, if you would be a candidate or not. For instance, there's one thing I can tell you, if a donor has a history of melanoma specifically, there are some centers that would proceed with that, and there's others that would not. So it's really kind of best to talk to the center directly and see what their specific requirements are. But most of the time, diabetes is going to be a contraindication to donating because diabetes impacts your kidney function. Same thing with sickle cell disease and lupus. these things can impact your kidney function. So it's not, that we're discriminatory. It's more just, we don't want to take a kidney from somebody when they could need a kidney in the future themselves or have, reduced renal function. So that would be not safe for someone to donate in that situation. And some of the other things like active substance use, we want to make sure that if somebody donates, there's no harm that's going to come to them. So that's something where, if we have active substance use going on already, and then, it's possible that that could even get worse after they donate because it can be, psychologically challenging to donate, of course. Cancer within the past 3 to 5 years, like I said, it really depends on the type. So I would check with the center. But I think I always tell people if you want to donate, just fill out the questionnaire and then we can look through it. And if there's any follow-up information we need to get, then we, of course, will kind of call you back and get more information and get records and things like that. So best to reach out to that transplant center that you're working with and see what their requirements are. So the evaluation, I talked a little bit about it, but just to get into more specifics, it does vary from center to center. But just to give you kind of a general overview of more than likely what would be involved based on my experience, it would be lab work. Of course, we want to check your kidney function, make sure that that is good enough to be able to proceed. And there's a few ways that we do that. We at University of Chicago will do a couple laboratory draws and also a 24-hour urine collection to analyze that. So that varies center to center. Some centers in the beginning do an imaging test or a laboratory test called a nuclear medicine glomerular filtration rate. So it varies by center, but kidney function, of course, is very important that we make sure that's good enough to be able to proceed. We check your general health labs and make sure that none of them look concerning. We also check infectious disease testing, and of course, make sure there's nothing that would be transferred to the recipient should the transplant take place. We also perform a CT scan of your abdomen and pelvis, and that would be done with contrast. And one of the big reasons that's done is to look at your kidneys, make sure you have two of them, and look at your vasculature. Make sure that all of that looks okay and, we could proceed. And also your entire abdomen and pelvis, just to make sure that we're good enough to, proceed and there's no abnormalities. A chest x-ray to look at your heart and lungs. Of course, cardiac testing to make sure that your heart is fit enough, to proceed with surgery. And, it kind of varies, at least at University of Chicago, which testing we're doing, just depending on your medical history and age and things like that. And then also, undergoing evaluations with social work, the living donor advocate, pharmacy, dietitian, surgeon, nephrology. And all of these are incredibly important evaluations. We want to make sure that it's safe, for you to be able to move forward with this. And what happens after you go through all of this testing is that your results are reviewed by a multiple disciplinary committee. So this is a group of professionals that are kind of there to make a decision and kind of determine what the next step should be. And I always tell our patients, there could be more kidney doctors or nephrologists than what you saw in clinic. You saw one person, there's potentially up to 5 or 6 that are going to be on this call, and same thing with the surgeons and, other social workers as well, and dietitians and et cetera, et cetera. So it's always possible to kind of get more expertise on this, and that basically, the follow-up may be different than what we tell you in clinic because we have more brains at work. And then your coordinator will communicate the results back to you. And so the one thing I always warn people about this when they're starting is it could be that you have to be presented a couple different times, because there may be follow-up that we need to do, and then we need to make sure that that follow-up looks acceptable too. So that part, I think, is what can get most frustrating for our living donors, because we, of course, want to make sure to look under, every nook and cranny and make sure that they're safe and, be able to do this. But I think, sometimes people could get a little fatigued by the process sometimes. But of course, it's all in the donor's best interest. So let's say we get to the point where someone is approved and their recipient's good to go, then we can schedule the surgery. And so we always ask our donors during the process, like, what's your preference? When would you want to do this? When are you free, to do it? And sometimes people are just kind of like, as soon as possible. And sometimes they're like, I have someone right now who's like, I can only do this in November. And the recipient's like, that's fine with me. So we, of course, prioritize the donor's availability, for them to be able to do this and have it work for their lives, of course. So that's kind of how that works. So we also talk about this, before patients come in, but there are, of course, surgery risks. Unfortunately, and this is not an exhaustive list. There's, many, many more things that are more rare, but these are the things I tell people. This is what I expect to have happen to you after you donate. One of the things I think we don't talk about enough is fatigue. We've had donors that even up to 6 months later, they can say, I kind of still feel like I'm at 98% of where I was before I donated. And, it's just still kind of feel like I'm not like 100% back to normal, right? So that can take time. It takes time for your body to adjust, and it's perfectly normal. Your body went through surgery, and then your body also is getting used to having one kidney. So, it can take time to get back to feeling, that 100%. You might be at 98% even, right? Most people, this is kind of more resolved in like a couple months or so. But just to kind of call that out, because I think it's important to highlight. Pain, after you have the surgery, there'll be some degree of pain. And, in our center, most people kind of say to me, like, I feel like it's there. I can't really like put my finger on it, but definitely I can feel that I've had surgery, but it's not preventing me from getting up and moving around or anything like that. It's not debilitating in any way. So, obviously you work with your center and make sure your pain meds are adequate. But I would say, most of the time that's well controlled by the pain medication. Scarring, of course, this depends on the transplant center, depending on the approach and all that. But there's always, of course, the risk of having visible scarring. And then specifically, if it's done laparoscopically, I would definitely highlight that some people can have some adverse GI symptoms or gastroenterology symptoms. The way that many of our surgeons approach this is by doing this laparoscopically, actually through your belly button. So it's possible that people, kind of have some GI upset because your intestines are actually moved during the surgery, and then you're given anesthesia and you're given pain meds. So sometimes I hear from people, it can even take a couple of weeks to kind of feel like you're back to normal. And, when a surgery is done laparoscopically, they put gas in your belly to kind of make it bigger so the surgeons can see, where they are going with their instruments, but, they aren't able to take 100% of it out. So it's possible to still have some in there. So people, can kind of feel a little distended or gassy afterwards. Some of the less common things, and again, not an exhaustive list. There's all kinds of, nerve pain, things like that. But some of the bigger things, wound infections and things like that. In hernia, that happens in 2% of cases from what we've seen. And a wound infection, of course, could be treated with antibiotics. A hernia would require an additional surgery. So, and I'll get to this in a second, but one of the things that we tell our patients is, and this is always a big bummer for our donors, like you can't lift anything greater than 10 pounds for at least 8 weeks. Because of that risk of hernia. And of course, we don't want you to need an additional surgery after you've donated your kidney. So, so we do educate our patients very heavily on that. Also, bleeding is a risk. And, when you come in for surgery, they'll kind of talk to you, or when you come in for evaluation, they talk to you more about that. And then, there's even more that I could go into, but it would probably take up quite a bit of time so that, if anybody has any follow-up questions afterwards, I can always add on to this list. But those are kind of the bigger things. Your risk of mortality during living donor surgery is 3 out of 10,000 procedures, so a pretty small risk. So what's the typical post-surgical timeline? You're hospitalized for 1 to 2 days. It just kind of depends on how people are feeling. And I know most places are, we're checking in with the donor and saying, are you comfortable to, do you feel well enough to leave and all of these things? And, if there's any reason to keep someone, we absolutely do. So we want to make sure our donors are okay to leave the hospital and feel comfortable. So most of the time, just 1 to 2 days. Your post-op appointment, we usually schedule, 1 to 2 weeks, you'll have to come and see the surgeon. Like I said, no lifting greater than 10 pounds for, at least at University of Chicago, it's 8 weeks. But we expect you to be pain-free 2 to 6 weeks post-donation. And that's kind of the timeline we also tell people to kind of take off work. It just really depends on, what you're doing for a living. If you're doing something very physical, it could be you have to take a full 8 weeks, unfortunately. But if it's something where you're working at a computer like I do, then you could take probably more like 2 to 3 weeks off to recover. And, very rarely do we hear back like I need more time and whatnot. Most of the time, that's pretty sufficient for people. So the risks of donation overall, I think there's kind of this myth that you're going to require a kidney transplant and all of these things. Most of the studies have shown here that, like, for instance, hypertension, you're at the same risk that you were without donation. And same thing for chronic kidney disease. There's really no, additional risk. You're in the same risk as those in your demographic profile. But of course, I always caution our donors, it's always a good idea to keep kind of very involved in your health and going to those follow-up appointments. We do follow up with patients 6 months, 1 year, and 2 years after they donate. But beyond that, we want people to be prepared to kind of, be going to the doctor regularly, at least once a year, like you normally would, and maintain a healthy diet and things like that, and take care of yourself, and be checking on those labs, because if kidney disease were to develop, it could develop, more quickly for someone who has one kidney. Of course, if we thought that was going to happen, we would not let you donate. But of course, it's a good idea to keep an eye on these things and make sure, that you're not at risk for that. I would like to definitely highlight with pregnancy, there are additional risks. Your risk for preeclampsia and hypertension is definitely higher compared to somebody who had not donated. And we also would like our donors to know they need to wait at least 6 months to get pregnant after donation, for safety reasons, of course. So overall, people who donate they tend to outlive the average person, and the reason for that could be a couple things. A lot of the donors that we see, come through, they tend to be somewhat healthier than, the average person. And also, I can say too, I've seen this process kind of invigorate people to, maybe change some things in their lives. Like if someone comes in and they're regularly smoking and then they stop smoking and then they, know I have to keep this up after I can't start smoking again. So, there could be multiple factors here, but the testing for this is pretty rigorous. If there's any reason to not, proceed with someone as a donor, we would not want to proceed with them and put them in a situation that is unsafe for them. And that's the other thing that I've learned in doing my job. More than likely people will be upset that they can't donate more about anything else because they really want to do it and help this person. And, but it's, we have to kind of stand strong and say, we can't let you do this. We don't want anything to happen to you that would endanger your health. So, yeah. We're going to take some questions at the end. So start thinking up some good ones now. But yeah, I hope that helped give you some clarity on what the process kind of looks like. And thanks for your time and attention. And then I'll turn it back over to Anita.
Thank you, Amy, for that information and also a very thoughtful overview. I really appreciate that. As a reminder to our audience, we will be holding all questions until the end of the session. So please feel free to submit them in the chat, whatever that comes to your mind. It is now my privilege to introduce Monica Fox and Olivia Fox, a living donor and recipient pair who will share their personal journey and experience with kidney donation. Monica Fox is the Vice President of Government Relations at NKFI, Kidney Recipient, and Olivia Fox is a Transplant Outreach Coordinator from UI Health Living Donor. And I leave the podium up to you guys now.
Thank you, Anita. Good afternoon, everyone. Thank you for taking this time to join us. As she stated, I'm Monica Fox. I'm also a dialysis survivor and a two-time kidney transplant recipient and a mother, a proud mother and grandmother. and I'm joined by my amazing daughter. As Anita shared with you, she's an outreach coordinator for the Transplant Surgery Department at UI Health, and she's an MBA student and an awesome mother and my living donor. Um, Tabitha, can you start the slides? Are we seeing the slides yet? Okay, next slide. Okay, go ahead, Olivia.
All right. In 2013, I was a sophomore studying mass media communication at the University of Missouri. I had always had a close relationship with my mom, but something about being away from her during that time drew us even closer. Because let me tell you, at the end of high school, we weren't good friends. But by the time I left and, I was gone for a little while, we got really, really close. We talked on the phone multiple times per day, not once, not twice, but at least 3 to 5 times per day. And that might even be, it might have been more than that. Because of how much we talked, one day I noticed something different about my mom, and how she sounded. She sounded short of breath, and she told me she was leaving work early, which was something that I had never in my 18, 19 years of life at that point had never heard of my mom doing. My mom had never been sick in my memory, and so I knew something was really wrong. I called my mom's sister, my favorite aunt, who agreed to help because she thought that this sounded like a really serious situation. And she met my mom at home to help her get to the emergency room.
On that day, I went from work to the ER to the ICU. And I remember my sister telling me that my heart rate was dangerously high and my blood pressure was low and my kidneys had failed. She said, "You have a huge fight ahead of you. What are you going to do?" I told her, "I have to fight. Olivia needs me." So after 3 weeks in the ICU, 3 weeks in the telemetry unit, and 3 weeks in a skilled nursing facility where I received physical therapy and hemodialysis, I was discharged home and began an in-center hemodialysis. Shortly after that, I began the kidney transplant evaluation process. And upon that workup, they told me the wait in Illinois was 5 to 7 years and that most people don't survive for 5 years on dialysis. That was a tough pill to swallow. So they encouraged me to share my story to find a living donor. And when a friend stepped forward, he was told to lose weight without even receiving a physical exam. So this was quite discouraging. And with the guidance from others in the field, I transferred my care to UI Health. After that, several potential donors came forward, but none were a match or were able. Waiting wasn't easy, but I stayed active and purposeful. During my 3 years on dialysis, I volunteered with Gift of Hope Donor Network, and whenever Olivia was home from work, she joined me. Next slide, please.
During that time while I was
Oh,
still in college, I took every opportunity to learn more about transplant and living donation. Yes, I finessed these topics into my communications and English courses. It makes sense all around, I'm telling you. I learned so much. I learned so much that I decided that I would be my mom's living donor. It only made sense to me. I felt that if it was medically possible to help my mom feel better, then I would do everything that I could to help. At the time, I had read that living donors got priority on the waiting list if they ever became in need themselves. And I read many statistics and stories that said patients who received from living donors actually had better outcomes. I was absolutely sold. I was young and healthy, and selfishly, I couldn't imagine life without my mom. So just before my college graduation, I began living donor evaluation process at UI Health.
I was thrilled to pass the milestone of seeing her graduate. However, when she offered to donate, I struggled deeply with the idea of her undergoing surgery for me. The fear and anxiety were overwhelming because I didn't know much about living donation. I didn't know any living donors. I knew there wasn't any legislation to protect living donors at that time. And despite this, she moved forward with testing. And when she was found to be a match, even though I turned her down, I underwent additional evaluations, including a pelvic ultrasound, to determine the best placement for the kidney, like best placement for what kidney? I said. They said, your daughter's a match. I said, no, no, I didn't agree to accept it yet. But this allowed me to be totally ready for my deceased donor offer came. Next slide, please. Yes, next slide. My first kidney transplant happened in November of 2016. When the family of my hero Milton made the selfless decision to donate his kidney directly to me when they experienced his untimely death. That precious gift gave me my life back for over 9 years and eventually allowed me the opportunity to begin working for the National Kidney Foundation of Illinois, where I currently co-host the Journey Continues podcast, which is now on video, and I lead the team in outreach, advocacy, and partnerships. Most importantly, I was able to experience the birth of my dear grandson, Jacoby, who is the love of my life. Let's go back one slide, please. So in February of 2017, oh, I'm sorry, Livy.
In February of 2017, my time volunteering with Gift of Hope became a job as a community outreach specialist in the Community Affairs Department. I proudly spent almost 7 years educating the community about the importance of organ and tissue donation and encouraging people to register their wishes on their driver's license. I work with community and hospital partners to create opportunities for donor families to share stories of their loved ones who had left a legacy through organ, eye, and tissue donation. After my years of service on the donor side, I was honored to accept a position at UI Health at our world-renowned transplant program as a transplant outreach coordinator. In this role, I promote our program to potential patients and community clinicians and help identify areas where we can bring our transplant services to communities throughout Illinois to expand access to our outstanding transplant care. Looking back at my career, I'm so grateful that I have built a network within this donation and transplantation community. Donor families, recipients, living donors, healthcare professionals who have all shared their experiences and expertise that has really shaped my perspective on all of this. Many stories of hope and legacy.
In January of 22, I developed COVID pneumonia, which led to serious pulmonary and cardiac complications and a steady decline in my kidney function. After another ER admission in May of 2025, my cardiologist, Dr. Ardati, told us that he could save me or he could save my kidney. And without hesitation, Olivia said, save my mom. I have a kidney for her. This time she was resolute. No was not an option. She immediately began the evaluation process and was approved as my donor. Because of our professional backgrounds, we were both well informed about living donation. We knew many living donors and were aware that the Living Donor Protection Act had been passed in Illinois. And that knowledge made the decision easier for me this time.
For me, it was finally my chance. Throughout this 10+ year journey, we have always said that God was moving us around like pieces on a chessboard. And this felt like a move that I had been unknowingly strategizing for since my mom first got sick. Now it was my chance to do something for my mom, the woman who gave me life. I could finally return the favor. I was even more confident that the team that would be caring for us were my colleagues, because yes, I work at the transplant center where we were transplanted and cared for. Um, and these were my colleagues and friends. So I had the utmost confidence in that. I was getting the chance to do the deed that I promote daily. And I guess you could say it was time for me to put my kidney where my mouth is.
Well, in May of 2025, actually June, during that hospitalization, once my heart function stabilized, my kidney had failed. Dr. Benedetti, the chief of surgery, told me that I could receive another transplant, but I needed to get stronger and lower my BMI because women my age had better outcomes with the lower BMI. So after discharge, Olivia and I committed fully. We joined a gym, worked with the trainer 3 times a week, and followed portion control, low sodium meals. I also benefited from the recommended use of a GLP-1 medication. Within a few months, I reduced my BMI by 9 points. My A1C was normal. I was stronger and ready. So after 4 months of in-center hemodialysis on October 20th, 2025, we underwent a successful kidney transplant. Thanks to the team led by Doctors Benedetti and Svetnov, we are both healthy and doing well 6 months later.
On the day of surgery, I was filled with excitement and hope that my kidney would work well for my mom. That was actually my only concern that day, not for myself, but that my mom would feel better after all of this. We learned back in 2014 that I was a perfect match for my mom, and that was confirmed with the head-to-toe reevaluation that I completed in the summer of 2025. Living donor evaluation is valuable for the purposes of donation, but it's also the most comprehensive testing you can get, which is a good thing for anyone. I was able to get up and walk just hours after coming out of surgery, and my mom's room was the only place I wanted to go. I wanted to see that she was okay, and I wanted her to see that I was okay too. We did it. As we recovered, I worked closely with the UI Health marketing team and our own personal network to share our story immediately. Though over 10 years had passed, our mission was still the same since our time volunteering with Gift of Hope, to share our story in hopes of reducing the waitlist time. And here I wanted to add here that Amy mentioned gas being one of the big risks for living donors, and you don't really think about gas being a big deal, but that was the biggest thing that I struggled with in my recovery. And I will also say that it did take me longer than 3 weeks. I was banking on about 3 weeks, but it took me a good 6 weeks or more to feel better. So I just want to tell living donors, to give yourself grace and walk that gas out. No medicine is going to help you. None of those antacids or anything like that is going to help you. Get a walking pad. Hopefully, when you donate, it's in one of the 90 nice days that we have here in Chicago. But yes, walking is your biggest help during recovery and my biggest suggestion for living donors after you give this precious gift. Of the nearly 4,000 people in Illinois waiting for a kidney transplant, too many never receive one. Our family has been blessed to experience both deceased and living donation, and we want to help improve those odds for others. So, both personally and professionally, we have a few things to ask of anybody that's listening or anybody that you share this with when you leave here today. First, if you haven't done so already, register your wishes to be an organ donor on your driver's license. And just as importantly, have that conversation with your family and loved ones. We plan for so many things in life, yet we often avoid the certainty that we all share. Decide what type of legacy you want to leave. Next, please consider becoming a living donor. One selfless decision can save a life and transform an entire family's future. Living donation not only saves the person who you are donating to directly, but it also opens up room for someone else on the list to receive that next deceased donation that comes up. So living donation really, really helps the recipient, their family, and someone else on the list as well. Next slide.
Um, oh, we're missing some photos there. I don't know what happened to that slide. Okay, our journey is a testament to the power of faith, resilience, and the incredible gift of donation. Because of selfless choices, both from a living donor and a donor we will never meet, I'm here today. My health is so much better uh, after this transplant that we had the pleasure of going to Disney World to celebrate Jacoby's 5th birthday in February and our successful kidney transplant. We were honored to be chosen to be the Grand Marshal for the Festival of Fantasy Parade. They made an announcement all over the park about what we were celebrating, and thousands of people congratulated us and wished Jacoby a happy birthday. So if our story inspires even one person to register, to have the conversation, or to consider living donation, then it's made a difference. Together, we can turn hope into action and give more families the chance at life. I'm grateful to my NKFI team and my family for all the amazing support that I've received. Thank you.
Thank you.
Thank you, Monica and Olivia, for sharing such a meaningful and personal experience. It was very moving. Thank you. We will now move into a question and answer session. For our audience, please do submit your questions in the chat and we will answer as many as we can if time allows. I don't see anything right now, so I will go ahead and ask a few questions to Monica and Olivia. What are some common misconceptions that you have encountered about living kidney donation?
Well, one of the concerns, the first time that I considered living donation, my mom was worried at that time. I had not yet graduated from college. I had not yet started my career, built my own family, had a child. And so while at that time those all seemed like valid concerns, we also learned over the years, through a lot of people that we met and information that we read that um, people that are living donors can go on to live a healthy life. They can go on to have children after being living donors. They can continue going to school. They can graduate. I mean, I was at, I'm in the midst of an MBA program right now while I was a donor, so it's possible to do multiple things, at once. And living donation does not stop you from having a child or doing any of your regular physical activities. I know many living donors that have run marathons, climbed Mount Kilimanjaro, and so living donors can live a completely healthy life. And I know that's a concern for a lot of potential recipients or patients.
Thank you so much. And then my other question is, can you speak about the emotional impact of donation, both, before the procedure and also after the procedure?
Well, I'll start. For me, before the procedure, there was a lot of anxiety as a mother. You can imagine that um, it was concerning for me, even being so educated as I was by then. It still was hard to move past the anxiety of that. But I also I felt strong, and I felt that she was very committed and determined to do it. So that helped. After my emotions afterwards, I still haven't come down yet. Such gratitude. I wake up every day with a heart full of gratitude that can't even be expressed in words. It just has to be expressed with the actions that I take each day that I live.
Mhm. Yeah.
And then for me emotionally, I speak about organ donation and transplant and living donation every day for my job, being a transplant outreach coordinator.
Mhm.
And I have lived my own story now for, over 10 years. This has been our family story. And telling this piece of the story, I have to write it down. I don't know if you could tell that we were reading a script that we had written down word for word, because even though I can normally speak off the cuff, talking about this is extremely emotional for me. And in a good way. Like, I'm just so overwhelmed that this was even possible, that we're doing well, that I'm even here to share the story. So it's very emotional. It's good emotions, but I have now had to shift how I normally present this type of information because I bust out crying in the middle of talking about it, even 6 months later. So,
Yeah, so one of the things some of my patients have asked me was, I'm asking this question for everyone. In your case, Olivia, you volunteered. You said, Mom, I am willing to donate, but I have a few patients that have asked me, I am so hesitant to ask that question. To even a family member. I guess, what advice would you give? There's nothing to lose, by asking a question, but emotionally they're not ready to ask that question. What I guess what advice would you give to those feel that way?
Anita, I hear the same concerns when I speak with patients at dialysis centers every day. Patients are like, how could I ask my loved one for this? Or they worry about outcomes for their loved one and all of that. And I always tell patients, if you don't feel comfortable making that direct ask, just share some educational information with your loved ones about living donation.
Mm,
There are stories of living donation everywhere. I mean, I turn on the TV like and see a midday show, Tamron Hall, and there's a living donation story. So you can find some creative ways to, I think, bring the idea of living donation to your family by
mm,
sharing some testimonials and maybe some statistics about it. And once people hear those testimonials and that information, a lot of times people that'll make it click for them without you even asking. But I think presenting good educational information and facts to your family and loved ones about what's even possible gives them the opportunity to then think about it themselves, and then maybe they'll offer without even having to be asked.
yeah, that's a great idea. So
That's
at least they have that time to kind of, like sink in what are the factors before that person actually approaches and asks the question. That's a great idea. Yeah. Thank
Yeah, and I'll say that in my experience, I never asked anyone to be a living donor or to be tested, but I did share my story. And I shared the difficulties of dialysis, and I shared education about being living donors. I even had a nail technician who was doing my nails, and had a conversation, who offered to be a living donor for me. So, but I never asked anyone, not once. I couldn't bring myself to do that. I even felt anxiety around anybody who came forward to offer
you.
to be a donor. So it's important to share your story. I shared it all over social media, and that's how people learned, and they voluntarily came forward to try because of the information that I shared. So that's the
Yeah.
best thing for people to do. And the other thing is to get a family member to be an advocate for you. So I
Yeah.
know some people whose family members have posted signs in their workplace, and living donors have come forward in that way. And, they've shared by many different means with their loved ones. Okay.
Yeah. Oh,
I
wow.
was going to
Those are
add
two.
on to that as well. In my experience working with, many living donors, I feel that they all somewhat share similar personality types. And listening to Olivia talk, I was like, classic. This is a typical, like it's just like very like, so there are people out there that exactly like what Miss Monica was saying, you may share your story and they're like, oh, I'll do that. My husband is actually a living donor as well. He donated to my cousin.
Wow.
And when he heard, oh, okay, Tommy, oh, he needs a kid. Oh, well, I'll get worked up for that. Yeah, I can do that. It was just like that was his personality about it, and it's about a lot of things in his life. And he's always up at 5 a.m. doing laundry. That's just like that is so him. And it's honestly, there's many of these individuals who are out there who, you don't want to know what, if they want to do it before you ask them. And they're like, oh, yeah, of course it's just a natural thing. So I can't put like a scientific terminology on that. But from
Mhm.
what I've noticed, our living donors, they all share that kind of willingness to kind of jump up and volunteer. So you never know exactly like what Miss Monica was saying. You share that story and somebody may say, okay, yeah, I think I could do that. Let me check that out. So
Yep.
I think that's great advice to share your story.
Yeah. Thank you for that advice. We do have a question from the audience. I'm going to just read that to you guys. My son was diagnosed with chronic kidney failure 2 years ago and is currently on dialysis. He's also on the kidney transplant list. I was willing to give him one of my kidneys, but I was told that I was too old because I am 60 plus. Is
Oh.
there an actual age limit for donors? And do you recommend sharing a story on social media to solicit a, a living donor?
I feel like Olivia and I could probably both tackle this, but at least, at University of Chicago, we do not have an age cutoff. You could have a 75-year-old that is in better shape than a 50-year-old. It just
Yeah.
really depends on, working somebody up and kind of, seeing, where things lie. Obviously, if it wouldn't be safe for them to proceed, like I said, no transplant center would do that, and that's, we would of course not proceed. But we recently at University of Chicago in the past year we had, some a couple in their 70s where the wife donated to her husband, and we're doing great. So
Mhm.
definitely, and center to center, but obviously, no age limit, at some institutions.
So thank you for that question, whoever asked that question. Amy works for University of Chicago. I work for University of Illinois in Chicago. So it sounds like call one of us. We would be happy to evaluate you and see kind of evaluate you and see if you could be a living donor. We do not turn people away based on age, and that's for living donors and recipients at UI Health. I know a lot of centers also have an age cutoff of like 70 or 75 for living donors, or I'm sorry, for recipients. And that is not the case at UI Health. One of my surgeons tells a story of an 84-year-old lawyer that he transplanted, and he was still working every day, still, litigating and driving to work every day. And so, like Amy said, biologic age is not always the same as physiological age. So
Mhm.
come get evaluated with us.
So I guess it's a
And I,
matter of just evaluating all just multiple factors to really see if that individual is a good recipient or a donor in order to like to be transplanted or to give the donation to others. I guess that's what I'm hearing. Okay.
Yep.
All right. Thank you.
and I'll
Uh,
speak to the social media part. It's absolutely an awesome thing to do, to share his story, your story on social media. You might even you want to even express that you tried to be a donor and weren't able to, um, because someone will come forward. And like I said, you don't have to even ask, although as a mother, you may be willing to ask because it's your child. I certainly would ask if I were advocating for my child. But definitely go to social media, share the story, educate people about living donation, get as much information as you can, and good luck. Good luck. We'll,
Thank
I'll
you.
keep him in my prayers.
Yeah. Yeah, that person actually responded saying, "Thank you so much for this information. I used to work for the University of Chicago. My son is also on the UFC transplant list." That's great. Thank you. Um, and then, looking at both of you guys, you're just so strong. But we can also tell you've gone through some storms. I wanted to ask, what are some support systems that were most helpful during your journey? Can you guys please share that?
Yes, so in our case, the person who would have been my first line of support would have been my mom, and she was also recovering at the time, and we do not live together. We do live close, but we don't live together. And so it looked a little bit different than what it would have looked like if there were any other situation going on in our family. So my mom got a lot of support from my grandparents, her parents that we're still blessed to have. They're both in their 80s, but still doing very well and able to help out. Her sister, my aunt, helped both her and me out a lot. And I am actually an only child, but I have a group of friends, a group of girlfriends that are blood couldn't make us closer. And they really held me down during that time. I had friends that would come from Chicago to come get me in Homewood, to take me to school at UIC so that I wouldn't miss my classes while I was recovering. So I have a really, really strong group of girlfriends, and that extends to their families as well. So I always say that my village is very, very strong. And I do think that that's a really, really important part of becoming a living donor, as having a good support system in place. That's one of the things that we actually evaluate during the evaluation process. What is your support going to look like after? Because it is a lot to go through. And in the beginning, you're not in the first like couple days or week, you're not able to, really drive, and you're just not really feeling up to doing as much. I did a lot of laying around on the couch. And when I wasn't doing that, I was walking, trying to get rid of that gas. But a support system is super important to have at this time, family and friends to lean on. Oh, and then I also want to shout out my job, work. Knowing that my all of my work was taken care of, my colleague who I call my right hand, I never had to worry about that while I was out. So that was a huge stress relief to know that things at work were being taken care of and that I would be able to return when I was feeling well.
That's awesome. Having that support from your colleague is an additional, layer of help, and that's really awesome to hear. And then we are nearing the end of session, but I just want to let our audience know to please, if you have any questions, go ahead and put them in the chat as we have like a few more minutes left. And then I have one more question. What advice would you give to um, someone who's considering donation, but it's kind of still like, oh, I'm not sure, feels uncertain? What advice would you give to that person?
Well, I'd say get some education about it as much as you can. Reach out to NKFI, attend webinars like this, go to our website for information, even call our office, and we talk people through this all the time. And if you are dealing with a loved one who's on the list at one of the centers, call the center, talk to the living donor coordinator. There's lots of information and resources and support out here. So take advantage of all of that in order to educate yourself and feel more comfortable.
Thank you. Thank you all for your thoughtful questions and answers and the engagement today. This was just great. I really enjoyed it, and I'm sure the audience have too, and I'm sure all of you guys have as well. I'll turn it back to Rachel now for closing remarks.
Thank you so much, Anita, and thank you to our panelists. I feel like Monica and Olivia, I have heard your story before, but every time I hear it, I'm so grateful that I'm not on video because I'm sitting back here just kind of crying a little bit and just I'm so honored to work with Monica. And Olivia is kind of part of the NKFI family. Even though she doesn't work with us, she is one of us. So I just thank you all so much for joining us today. Before we wrap up, I just also wanted to really share a quick preview of what's coming next with Kidney Connections. In June, we'll be focusing on well-being and support and creating space for real conversations around coping and community. And then in August, we're going to shift into covering prevention and everyday habits to support kidney health. Finally, we also invite you to save the date for our in-person Kidney Connections program on Saturday, October 24th, and we'll be again at the Courtyard Marriott UIC. We'll be sharing more details soon, so please keep an eye out and please make sure to visit our website for the registration information. And then I'm just going to throw in one final mention for our Walk for Kidneys, which is coming up on Sunday, June 7th at Diversey Harbor. There's more information on our website, and we'd love to have you come out, join us, form a team, and walk. Thank you all so much for your time today, and we'll look forward to seeing you in June for our next Kidney Connections.
Thank you.